Good morning. I'm Don Walker, and I'm Communications Director for Brevard County Government. And we are here today for our bi-weekly update on COVID-19 and other county-related issues for, obviously, the month of December. We hope everyone had a good holiday. And we have a panel today, including Maria Stahl, who is the Administrator for Brevard County, Florida Department of Health. We have John Scott, who is our Interim Emergency Management Director. We have Matt Wallace, who is our Public Safety Director. And we're going to lead off today with Maria with an update on the COVID-19 situation in Brevard County. Maria?
Hi, good morning, everyone, and I'm Maria Stahl from the Florida Department of Health in Brevard County to give everyone an update of where we are currently in the cases in Brevard County. We currently have 16,208 cases as of this morning. We added 252 cases today. We have an overall positivity rate of 10.94%. Today our positivity rate was 7.58%. We added five deaths to our death toll. That brings us up to 450 deaths in Brevard County. And one of those deaths was associated with a long-term care facility. As we have all along, our hospitals have continued to be stable. We currently have 81 patients in our hospitals that have COVID, and that is all the hospitals in Brevard County, and we continue to have capacity of about 25% in our hospitals. To give a little bit of an update over the last 2-week period, our positivity rate over the last 2 weeks was 7.5%. We ranged in positivity from 2.45% to 10.85%. The median age of our cases are in the 40s, predominantly in age 40s. Our deaths over the last 2 weeks, we did add 29 deaths in our last 2 weeks. 50% of our overall deaths are associated with long-term care facilities. So as I say that, it's extremely important. I know most of us in Brevard County are doing a wonderful job with wearing masks and avoiding crowds. Particularly, this is important with those of us that work with the vulnerable population. Extremely important to not go to work sick. You do need to stay home. You need to stay away from the vulnerable population. Continuing with face coverings, avoiding crowds, doing hand washing. I'll lead in a little bit into vaccines, which we've all heard a lot about the vaccines in the media. Hopefully within the next week to 2 weeks, we will be starting to receive some vaccines into Brevard County. I wanted to stress, initially it's going to be very limited. The state has staged 5 hospitals throughout the state that will initially receive the vaccines, and that is one in Miami, one in Brevard, one in Duval, one in Hillsborough, and one in Orange County. Within a couple of days after they receive the vaccines, it will be rolled out to other hospitals within our state. The focus here is to vaccinate the healthcare workers, not the patients in the hospital. The priority for vaccines initially is going to be those in long-term care facilities, staff and residents, workers in healthcare facilities, and those over the age of 65, which is our most vulnerable population. And that's all I really have to say at this point. We continue with the majority of our deaths being over the age of 65. Thank you, Don.
Thank you, Maria. And obviously, vaccinations are a hot topic, and we've got our Interim Emergency Management Director, John Scott, here today. And John's going to provide some additional information on vaccinations and also on COVID-related safety. John.
Thank you, Don. Good morning, everyone. My name is John Scott, and as Don said, I'm the Interim Director for Emergency Management. I want to build off of what Maria led into when we talk about vaccinations. I think we've seen a lot of news lately about vaccines coming online, and that's excellent news. That's really where we're trying to get to, because a vaccine means light at the end of the tunnel. But what I want to caution everyone with is we've still got a long way to go in that tunnel before we get to that light. You heard Maria outline a bit of that prioritization. Let me talk a little bit about how that decision-making process works. So the CDC, along with some other groups, other large-scale medical associations, evaluate the vaccines as they come out, and then who is best suited to get them based on what the trials have said. They then provide that guidance to the state. The state will make the final recommendations as to how that is prioritized, and that's going to be an evolving process. So as additional vaccines come online from different manufacturers, things will get changed. As we get more information throughout the vaccination process, things will get adjusted and tweaked. So it's going to be a bit of a learning curve as we get through this process. And again, we'll, at a local level, take direction from the state and the federal government on how to do that, and then assist in making sure that our residents, our healthcare workers, our folks who live in long-term care facilities are getting the kind of access to those things. And then as that priority group expands, we'll be able to sort of then move with that. And there's a bunch of different phases onto how we get there. And I expect that as we get more information, we'll be able to provide more detailed information to not only what we are sort of in what we're calling phase 1A, but how we get to phase 1B, how we get to phase 1C, and then eventually phases 2 and 3. So we'll begin to work through those, but we are going to ask for patience. It's going to be a bit. We know that right now the Pfizer and the Moderna vaccinations are both 2 shots, both either 21 or 28 days apart. So that means you get your shot, and then 21 days you've got to go back and get the second shot. If you're Moderna, it's 28 days, and you can't get a Pfizer shot the first time and a Moderna shot the second time. So there's still some logistics we've got to work through that. We expect, based on everything that the federal government has told us, that in January and February we'll see more manufacturers come online. But it's important to remember that right now there's not a vaccine that's available to everyone today. There will be, and as we get more vaccine manufacturers online, that availability will grow. What we really need to talk about as we go through this, and I know we look at the news and we get very excited and hopeful, as we see, hey, Pfizer's got 10 million doses. Well, we got to talk about it in the terms of people. So 10 million doses at 2 shots is 5 million people. I think I saw an estimate from the CDC that there's 27 million healthcare workers in this country. So it's going to take us a little bit to get through these prioritization levels. And they're being prioritized by risk and exposure. So we want to make sure that we can support that. So how do we support that at a local level? Again, we make sure that those residents and workers who meet those priority levels have access to that. And the second piece we can all do as residents, and really as neighbors and community members, is making sure that we're continuing to follow all of the COVID measures that we know work. So that's wearing face covering, that's practicing social distance, that's being smart and avoiding large crowds, that's good hand hygiene, that's staying home if you're sick and making sure you're not spreading it, and really trying to limit your high-risk activities. I think we've done a really good job of monitoring those kinds of things, but we're also getting ready to go into the winter. And as it gets colder outside, that's going to push more of us indoors. So we've got to make sure that if we are sort of hanging out indoors more than we have been, we're really being vigilant when it comes to those COVID countermeasures that we've been so successful with. So let me just sort of swing all the way back and sort of come back to the vaccines and really just talk about what our key takeaways are going through the next couple of months. One, it's going to be colder, so we need to continue our COVID countermeasures. 2, be excited for the vaccine. Read all the information you can. Get as informed on the subject as you can. The CDC has just a treasure trove of information, and continue to update it as new information comes out. And then 3, be patient. It's going to be a while before we get everybody vaccinated. What the experts are saying now is we're talking late spring early summer, so May, June, and that kind of stuff, before we really have enough doses to get out to all of the groups, not just the priority groups, but to anyone who wants a vaccine. So again, light at the end of the tunnel. Extremely optimistic about where we're headed. But it's going to take us a little bit. And we need to continue to pull together and stay together with our COVID countermeasures so that we get through that tunnel to the light in the best position as possible. And we need everyone's help to do that. Don?
We know there's a lot of questions in the community about the vaccinations and about COVID-19, about the coming holidays, about how to handle it during cold weather. And I know John's touched on a lot of that. As we do with all of our Facebook Live events, and with no exception, we will be taking questions from viewers at the end of our program today. And they will be provided to us by Jessie Ray, who is the county's social media specialist. So she's monitoring Facebook. So if you have questions, please feel free to ask, and we'll do our best to get those questions answered before the end of our program. As I've mentioned previously, when the COVID-19 pandemic first began in the United States, the U.S. Treasury Department reached out to counties across the United States with money to help get their communities through the pandemic, help small businesses, help people that were having trouble economically due to layoffs or other situations. Obviously, Brevard County received some of that money, which was $105 million. And we've been using that money to help, like I said, small businesses, whether it's recovering from financial losses or even supplying themselves with personal protection equipment such as face masks, gowns, gloves, etc., hand sanitizers. So we're going to give a quick update on that. First of all, we have been doing distributions of PPE to small businesses. All you have to do is show up and basically provide, your business name and address to receive that equipment. And we have 2 events scheduled next week for small businesses to receive PPE, and that is on Tuesday, December 8th at Franklin T. DeGroot Public Library at 6475 Minton Road in Palm Bay, and then on Thursday, December 10th at Sandpoint Park, which is at 101 North Washington Avenue in Titusville. And those will continue as we continue to have PPE available and can get those events scheduled. But right now, those are the 2 most recent ones that are on the board, and they are next week. So that information is available. This event will be reposted on Facebook and on YouTube under Space Coast Government Television later today. So if you didn't catch those addresses and locations, they will be available later. So now I'm going to turn it over to our Public Safety Director, Matt Wallace, for an update on other CARES Act money and where we stand on that. Matt?
Thank you, Don. And good morning, Brevard County, and thank you for, again, tuning in with us. And these important sessions that we have, we're able to distribute information to the public so we can make the best informed decisions for you and your family that we possibly can. I hope everybody had a very safe and happy Thanksgiving holidays that just passed us. And I know everybody's thinking about Christmas and New Year's coming up. But please keep in mind the precautions that we've been talking about at nauseum up here as we get together for these holiday seasons. Today is December 3rd. As Don has talked about earlier, for our CARES funding that we received from the federal government, the $105 million, it expires on December 30th. So a lot of our programs that we have ongoing right now, there is a sunshine clause that's coming up without additional federal legislation or further guidance that we may get that could extend those programs. But we're looking at coming up on the end of these programs from the federal guideline standpoint at the end of this month. So I just want to reiterate again, if any of our Brevard County citizens are having any issues with rent, mortgage, utility, security deposits, if our small businesses have been affected negatively by COVID, if our individual families or other organizations out there need food of any type, we have programs available in Brevard County right now that can help you. The best thing to do is either, one, call 211 if you have access to a phone. If you have access to the internet, go to brevardfl.gov/Brevard Cares. And there is a litany of information and opportunity on that website that we can help you out if you need help in these times. So again, I can't encourage you enough if you're negatively impacted either from a business standpoint or an individual standpoint, please go to that website or call us at 211 and let us help you. There's a lot of information and a lot of chatter being out there in the national news agencies too about what's coming up in 2021, if there will be more federal funds coming, what are the regulations and what's going to happen with those. I will tell you, we are actively monitoring that with all our contacts we have at the state and at the federal level. And as soon as we hear something of any type of financial assistance programs that will be sent to the states and the local counties, we will absolutely get those words out and start those programs and get information of, again, how we can support our people. So please continue to bear with us and please continue to tune in to these important sessions that we have every other week on Facebook Live, because this is one of the main mediums we have that we can get the information and get those programs and those opportunities out to our public at large. Lastly, I'd just like to touch real quickly on the shifting of our message that we've had here at these Facebook Lives. You know, today is the first time we've talked about vaccines from our Emergency Operations Director and from the Department of Health. There is optimism coming. There is, as John said, get excited. But as we send this information out, we also want to make sure we are setting expectations, that you individually and your families have those expectations, that you set the timelines of when you know these opportunities will be available. And then so you can make those individual decisions as you and your family as we get that information out to you. So again, please continue to tune into us every other week here at our Facebook Live events and tune in, and we will make sure we get that information to you. So, Don, that's about all I have. I'll turn it back over to you. And again, thank you, Brevard County, for hanging with us.
All right, thank you, Matt. And Matt is right. 211 is an excellent resource if you need assistance in any way, whether it's financially or just you need someone to talk to help get through a tough time. They can get you to the folks that can help you out and also steer you to the resources that you might need. So it's not all the time COVID, and so because we have just finished hurricane season and we have other exciting things that are occurring in Brevard County, I'm going to turn it back over to John Scott to give you an update on where we stand as far as hurricane season and upcoming rocket launches. John?
Thank you, Don. So just sort of to put a fine point on hurricane season 2020, which is going to go down in record books as the most active season ever. Certainly set all kinds of records for number of landfalls. We were tremendously fortunate in Brevard County that while we had a couple of scares, we avoided any real impacts from it. And what I just want to touch on was how encouraged I was to see that every time we saw a scare, both our partners and our residents really took it seriously. Began to look at their preparedness options, making sure things were in place so that if the impacts were more severe, we were ready to go. So I want to say thank you to everyone out there for everything you did to do that, to get us to that point of readiness. I also want to point out that we are, as we come out of hurricane season, we go into our severe weather season. So as cold fronts push through, we'll see more opportunities for some tornadoes and things like that. So it's a reminder that while hurricane season is our big weather event that we all pay attention to, one of the prices for living in Florida and all of our sunshine and fun times is, weather is something we have to watch year round. So as we transition to the colder parts of the year, we've got to watch our severe weather. It's a great time to make sure you've got a NOAA weather radio. So if there is an outbreak or a sort of an outbreak of storms as it comes through in the nighttime, you've got something that can wake you up to alert you to that. There's a lot of different notification services out there. You can visit our website, which is embrevard.com, to sign up for Alert Brevard, where you'll get a text to your phone should a tornado be in your area in the middle of the night. That's why our big concern is always have the ability to wake someone up and let them know that the weather has changed and they need to take action. And then, for us at the EOC, we continue to work on what has been a very eventful and historic space launch year. We were fortunate enough to have returned humans to space twice now. We continue to march forward with that. And then what is a very busy launch calendar as we continue to have more and more launches We have another 3 or 4 coming up this month. So again, continue to make sure you're paying attention on those things and staying vigilant. Thank you, Don.
Thanks. There's a common expression, if you don't like the weather, wait a minute, and that's kind of, we were so happy to finally be out of hurricane season. Mother Nature dropped the temperature on us by 40 degrees. However, that prompted us to kick off a new campaign on our social media sites that's when it's brisk, avoid the risk. So basically just getting the message out there that if you're stuck inside because of the weather or you're shopping, just remember to social distance, to wear a mask. Don't forget to protect yourself and those around you. Now we will turn it over to Jesse for any questions that we may have received during our event today.
Awesome. Thank you, Don. I just want to start by acknowledging that I understand, for those of you who are watching, that certain people tend to dominate the comment section of this, so I apologize if I'm missing anybody's questions, but I do believe I got them all. So again, apologies for those who tend to dominate the comments. So moving on, I have a couple of questions from the media and then some from our chat here. So we'll start with the media. So Maria, I believe this one's for you or John. The latest weekly White House Coronavirus Task Force report said that if state and local policies do not reflect the seriousness of the current situation, all public health officials must alert the state population directly. Since the state and the county have not issued new restrictions, what do you plan to do in light of that White House Task Force recommendation beyond the basic things that you have recommended, like wearing masks in public, hand washing, and social distancing?
I can start, and then I'll hand it over to John. Is everyone, if not aware, I think most people do know that the county health departments in the state of Florida are integrated with our state. So we are not individual health departments such as they are in other states. So we really do follow the guidance of our state health department. And that's where a lot of the guidance comes from. As I say that, the measures are exactly the same as they've been all along, and that is wearing your face coverings, social distance, especially if you're indoors, avoiding crowds, hand washing, and as I said, staying home when you're sick, and staying away from others, even in your household when you're sick. And those are the most important mitigation measures that we can do to avoid spreading of COVID-19. John, do you have anything to add to that?
I do. I'll just follow that by saying, one of the other things I think we work very hard on as a team is to make sure that as new information is available, we're getting it out there as much as we can and alerting people. I mean, you can see that today as we finally, I think, have reached a point where we have some vaccine information that we have enough detail to really provide, a good idea of where we are and what the next couple of weeks and months will look like from a building block perspective with the vaccines. And that's what we're going to continue to do. As new and better information comes out there, we will share it as rapidly and transparently as we can.
Jesse?
Awesome. Thank you. Sorry, writing a couple things down. Okay, I believe this is back to the same two. What issues have you seen related to Thanksgiving gatherings, travel, and large-scale events in the county, including college students coming home for break? And what guidelines would you give for Christmas and New Year's Eve gatherings at this point?
I can truly say it's probably a little too early to see any impact from Thanksgiving because that was just last week. Generally, we see upticks related to events about 2 to 3 weeks after the event. So it is a little too early to see the college kids coming home and any gatherings at Thanksgiving. As to moving into the holidays season and New Year's, the exact same measures that we had for Thanksgiving are the measures that we should be following. Avoiding large gatherings, avoiding travel if we possibly can. Everything is exactly the same as it was for Thanksgiving. I cannot see a decrease of cases happening between now and Christmas, which is just several weeks away. So exactly the same measures. We all have to be very meticulous and keep our eyes open and follow the basic measures we've all been talking about. John?
I think you nailed it.
Excellent. And then, is it true that the manufacturers are 100% free from liability for any adverse medical issues that may arise from the vaccine itself?
I'll take that one, and the short answer is no one here is a lawyer, and I think liability was best sort of handled for them, and at the federal level, that's something that the feds and the vaccine manufacturers will have to work out.
Okay. And then kind of in that same vein, is there a way for the public to monitor reported adverse effects from the vaccine if there are any?
Absolutely. The CDC is I think, doing a tremendous job, especially on the vaccine standpoint of things, that's being as transparent as possible with that. So continue to monitor the CDC's website for those kinds of things. As, you know, I talked about it earlier, as more information comes out, you know, we'll learn in real time what this is. I mean, we know from a vaccine standpoint what they saw in the trials, but as we take this to a larger group, there's a lot of monitoring that's going to be going on. You're not just going to be able to get the vaccine and walk away. I mean, we're going to know who's been vaccinated. If people are having issues, there'll be lines they can call. They can always call their primary care physician to report any issues. So there'll be a lot of options for this. I mean, I think you're going to have a lot of eyes watching how this goes.
Okay, awesome.
I can add to that also. With every single person that gets the vaccine, they will be getting an informational sheet. For other vaccines, people may know of them, the informational sheets that you actually get. In this case, each manufacturer is going to have a different informational sheet. On that informational sheet is going to talk about the adverse reactions that are known at this point. And primarily, it's going to be the flu-like symptoms. They're all saying that these vaccines are going to cause a little bit of flu-like symptoms, nothing major, but a little bit. If there's anything that you have that is not on this informational sheet, there is going to be a number to call and report that to. And it's exactly the same as with any vaccine. It's a number that you call to report an adverse reaction.
Okay, thank you so much for that. Dawn or Matt, this probably goes to you. Will Brevard go to a mask mandate until the vaccine is ready?
I'll address that. We've had two occasions where the Board of County Commissioners has discussed and considered a mandatory mask policy in Brevard County. They're really leaving it up to personal responsibility. Hopefully everyone is getting the message that these types of actions that you can take on a personal level will help protect you from either spreading or contracting COVID-19. So currently the commissioners are leaving it up to personal choice, but it's encouraged, and we continue to recommend the CDC recommendations that are to wear masks and to practice social distancing, hand washing, and also hand sanitizing, as well as staying home if you're sick.
Awesome. That's really all the questions I have. So just to remind everybody the way that you can follow us on social media, you can follow at Brevard EOC on Facebook and on Twitter. You can follow Brevard CO_FL on Twitter to follow the government page, or you can follow Brevard County Government on Facebook. You can also follow us on YouTube. That is SCGTV 499 on YouTube. So for those who want to be able to see these updates but maybe don't have social media, don't want to be on Facebook, feel free to follow us there. You don't have to have a YouTube account to follow us, and those are the best ways to see the most up-to-date information coming out of the EOC and the government.
All right, thank you, Jesse.
You're very
So we will continue our regular updates on COVID-19 and our Facebook Live events, with the next one scheduled for December 17th at 11:30 a.m. And with that, we will conclude our event today. Thank you for watching. Stay safe.